Good afternoon, everyone. I will start, as I always do, with the statistical update on COVID-19. An additional 5 positive cases were confirmed yesterday, which takes the total number now in Scotland to 18,196. Now, let me point out that this is the second day in a row in which the number of new cases has been in single figures. And to put that into context, the last time that happened was March the 11th. So that is a sign of how far we've come and the progress we have made. A total of 826 patients are currently in hospital with the virus, either confirmed or suspected. That is 54 fewer than yesterday, and it includes a reduction of 17 in the number of confirmed cases. A total of 18 people were in intensive care last night with confirmed or suspected COVID, and that is 5 fewer than the number we reported yesterday. And since 5th of March, a total now of 4,034 patients who had previously tested positive and required hospital treatment have now been discharged from hospital. However, in the past 24 hours, 2 deaths were registered of a patient who had been confirmed through a test as having COVID-19, and that takes the total number of deaths in Scotland under that measurement now to 2,482. Now, as I always do, and even as these numbers thankfully now reduce, I think it is important to continue to do this. So I want to emphasise again that these numbers are not just meaningless statistics. They represent individuals whose loss is a source of grief to many people. And therefore, I want to again send my deepest condolences, not just to the families and friends of the 2 deaths, people who died that I have reported today, but to everyone across Scotland who is currently grieving as a result of this illness. And again today, because there are people across our country, notwithstanding the decline in the number of cases, who continue to go above and beyond the call of duty. That clearly includes our health and care workers, but there are many other key workers across the country continuing to do so. So my grateful thanks are with all of you for the incredible work you continue to do. Later this afternoon, we will publish, as we do now every Thursday, the latest estimate of the R number in Scotland, which, as you will recall, is the average number of people that would be infected with COVID by one infected individual. Now, last week we estimated that the R number was in the range 0.6 to 0.8, and you will recall our aim is to keep the R number under 1. Our modelling work suggests that this week the R number hasn't changed, that it remains in a range 0.6 to 0.8, so it continues to be under 1. We also expect that our estimate for the number of infectious people in Scotland will have fallen further when we publish the report today. Last week we estimated that on the previous Friday 2,900 people were infectious, and I expect that today's estimate will show that now to be around 2,000. So all of these figures demonstrate again the progress we are all collectively together making in the fight against COVID. And they are the reason why, as I gave some more detail of yesterday, we are now able to make some further changes to the lockdown restrictions and give greater clarity about our likely path out of lockdown in the weeks to come. Although I must stress that all of the indicative dates I gave yesterday continue to be dependent on continued progress against the virus so that we keep it and get it to the lowest possible levels. Now, all of that is good news, and I know people across the country are anxious to get back to normal. I know I am, and I will not be alone there. And businesses are obviously anxious to open up and start trading again. All of that is extremely understandable. But it must also be accompanied by an understanding of the risks that we still face, by ongoing vigilance and by a collective determination on the part of all of us to do what is required to reduce these risks. My main worry right now is that we start to believe that the virus has gone away and that it no longer poses a risk, and that as a result we all drop our guard and simply go back to life exactly as it was before we were dealing with this epidemic. And that would be a mistake, and it is a mistake that would be very costly. At every stage, we need to remember that the virus has not gone away, and it is very, very unlikely to simply go away of its own accord. There are places right now elsewhere in the world, some states in the USA, for example, and parts of Australia that look as if they are already dealing with a resurgence of cases. So my plea to everybody today, and this will continue to be my plea for some time to come, is please do not forget that the virus is still out there and it is still highly infectious. And if we give it the opportunities to spread again, if we allow it bridges from one person to another that it can jump across, it will take those opportunities in a flash. And a resurgence in cases could force us to postpone our reopening plans or even reimpose some restrictions, as the places elsewhere in the world I've just mentioned are already having to consider. So we must take care and we must adopt the right mitigating measures at all times. That continues to be essential. And some of the basic hygiene measures that I will come back to at the end of my remarks are actually more important for us all to comply with now than they have been at a previous stage when we were all in the main staying at home. So all of that is relevant to the first of the two items that I want to briefly update on this afternoon before I hand over to the Cabinet Secretary and then to the Chief Nursing Officer. I gave a statement in Parliament yesterday that many of you will have either watched or caught up on since, announcing some indicative provisional dates for changes to lockdown measures that will be happening during July in the later stages of Phase 2 and then into Phase 3 of our route map out of lockdown. However, today I want to remind you of the changes that we announced last week that will come into effect on Monday. From Monday onwards, some indoor workplaces that have so far opted to remain closed in line with guidance, such as factories, labs and warehouses, can start to reopen again. Non-essential offices and call centres, though, must remain closed at this stage. Workplaces that are reopening should apply strict physical distancing and hygiene measures, and they must comply with all other aspects of health and safety guidance. Now, the vast majority of employers have been extremely responsible throughout this crisis, and I am sure they will continue to be so, and I'm extremely grateful to them for that. But I would remind workers that if you genuinely think your working conditions are unsafe, you do have rights under employment legislation. In particular, if you have a trade union in your workplace and you have concerns about your working conditions, you should speak to them. From Monday, outdoor playgrounds and outdoor sports courts will also be able to reopen. Outdoor businesses like zoos and garden attractions can also reopen. However, for the first few days until we hopefully lift this guidance at the end of next week, you shouldn't be visiting them unless you live within around 5 miles of them. And where these places are ticketed, tickets should be bought in advance. Restrictions on moving house will also be lifted on Monday. Updated guidance on that was issued 2 days ago. Registration offices will reopen for essential businesses and marriages and civil partnerships will be permitted, but they'll have to take place outdoors with limited numbers. Finally, on Monday, retail premises of all sizes can reopen if they have outdoor entrances and exits. Outdoor markets can also reopen. Indoor shopping centres will remain closed at the moment except for access to essential shops like supermarkets and pharmacies, but we hope they will be able to reopen on Monday the 13th of July. Shops that are reopening on Monday, and that will be the vast majority of shops that have been closed up until now, must ensure that appropriate physical distancing and hygiene measures are in place, and will be publishing updated guidance for the retail sector tomorrow. I'll say more about that then, when I will also visit a shop that is preparing to open to see for myself the steps that they are taking. I also want to stress that there's a responsibility here on all of us as customers as well as on retailers. I want us all in the weeks ahead to support the retail sector, to support shops as they try to get back to normal. But we must all shop responsibly. The experience of shopping is going to be a bit different, and there will be times when retail staff ask us to follow rules that hadn't previously been in place. And it is vital that we listen to them and follow the advice they give, and to treat them with respect as they do the jobs that they're there to do. And please, everybody, wear a face covering in shops, because that will help to protect staff and other shoppers. And when other shoppers wear a face covering, they will be helping to protect you too. The final issue I'll touch on briefly relates to tourism. Later this afternoon, the first meeting of our Tourism Recovery Task Force will take place. That is co-chaired by the Tourism Minister, Fergus and the Business Minister, Jamie Hepburn. It will bring together more than 30 people with expertise and experience across the whole tourism sector and indeed the whole country. The task force will look at a number of pressing issues, for example, how we promote the staycation market for domestic tourism, how we support training and skills, consider how the conferences and events sector can best recover in due course, and looking at the funding support available to tourism businesses, including whether there are currently gaps in that support. We know the vital importance of tourism to communities right across Scotland. It's important to our economy, but tourism is also part of how we sell ourselves and to the world, and we have such a great reputation. We're already doing a lot to support the tourism sector through our business support measures, and I hope that the gradual reopening of the sector during July will give some measure of hope for the future. But we do know just what a serious blow COVID has been, and we will do everything we can to help tourism recover. And the task force is a further important way of doing that. So let me end now simply by highlighting our key public health messages. Again, I'll make the point that as you hear me report figures every day that show progress going firmly in the right direction, and when you hear a lot of discussion about restrictions being changed and lifted, and you hear some people expressing opinions that we should be lifting these restrictions more quickly, it might be tempting to think that we can all relax more and get back to normal more quickly. And you might start to think that the rules don't matter as much. But we're only able to change restrictions now because so many of us have stuck to the rules, and we will only be able to continue this progress if we continue to do so. And these rules now, basic hygiene measures, as I said a moment ago, are much more important as we start to go out and about and interact more with each other. So remember, right now you should still only meet up with other households outdoors and only 2 other households at any one time. You should only go indoors in somebody else's house if you're going to use a toilet or get through to a garden, and you should make sure you clean any surfaces that you touch as you do that. The public health campaign we launched last week, Facts, summarises the key points you need to remember. Face coverings should be worn in enclosed spaces like shops and public transport. They are mandatory on public transport, and we are still considering that for shops. Avoid crowded places, even as places open up and you are able to go to different places. Don't go to places that are crowded because that poses a higher risk. Clean your hands and hard surfaces regularly. 2-metre distancing remains the rule right now, and self-isolate and book a test if you have symptoms of COVID. If all of us remember these 5 basic measures, and if all of us comply with these 5 basic measures, we are reducing the ability of this virus to spread between one person and another, and one household and another. So in that way, we are all playing our part in staying safe as individuals, protecting others and saving lives. So my thanks to all of you for doing all of that. Please continue to do it. I'll hand over now to the Health Secretary, who's got a word or two to say today about care homes, and then the Chief Nursing Officer will say a few words too.
Thank you very much, First Minister. Currently, and for some time, only essential visits to care homes have been permitted. Now, I know that these necessary restrictions that were placed on care homes and the pause on normal activities and routines have been both difficult and at times distressing for people living in care homes, for their loved ones and for the staff. The decision to restrict visitors was not taken lightly. It was informed by scientific and clinical advice and was taken to protect those living and working in care homes and visitors from the risk of infection. But significant progress has been made, and we have seen improvements in the number of care homes with ongoing infections, to the extent that we can now see a phased return, a cautious phased return to visiting in care homes when and where it is clinically safe to do so. So today we have published detailed guidance to support that phased return to visiting and communal activities in our care homes. A care home will be able to permit visiting if they have had no COVID cases or been COVID-free for 28 days, as agreed by the Director of Public Health. For those care homes, residents will be able to receive visitors outside from the 3rd of July. This will be for a single nominated visitor who will require to wear a face covering for the duration of the visit, and with physical distancing, hygiene and other appropriate safety measures in place. The detailed plan and the guidance has been produced by the Care Home Clinical and Professional Advisory Group, which is a multidisciplinary group chaired by members of the Chief Medical Officer and the Chief Nursing Officer's Directorates. It is crucial that we do this incrementally and proceed with caution to protect residents and staff. When the scientific and clinical advice is clear that it is safe to do so, then we can consider gradually opening up further visiting options. In all of this, our care homes will be supported by the local NHS health protection team. I know that this will be important and I hope welcome news for families and friends with loved ones in care homes. I know how long you've been waiting to see them. But I also know that you will understand our caution. When the evidence shows that it is the right time to move to the next stage of the plan, we will provide you with an update. And for those in hospital or in other healthcare settings, I'm pleased to say that we're also working on a phased reintroduction of visiting there, and I hope to be able to announce details of that next week. Finally, let me take the opportunity to thank everyone for their patience and their understanding, and to care home staff for all they have done to promote the well-being of those they support during what has been a very challenging time.
Thank you, Health Secretary, and I'll hand over now to the Chief Nursing Officer.
Thank you, First Minister. As the First Minister and the Cabinet Secretary have said, we've taken a long time and it's been hard in terms of decisions that have been made to keep people safe. Clearly, the tragedy and the sadness of people passing away and the grief that has left their loved ones is something that some of us share, but many of us don't. What we all have shared, however, is the way that our lives have changed because of COVID. Nobody has been left untouched. Our health and social care staff have worked tirelessly to care for people who've had COVID, but also those who've needed emergency care or our shielded population who've needed care at home. And they've done that willingly and seen it as a deep privilege. However, it has been incredibly hard and they've made personal sacrifices to be able to do that. And as we're moving to this next phase, our society is beginning to have choice. Where our rules told us to stay at home, only go out once for exercise and for essential shopping, there was little in the way of decisions that we had to make. And what I'm asking people please to do is be purposeful in what you are now doing. Clearly, on public transport, wearing a facial covering, if we're looking at facts, is mandatory. But what I would say to people is there are those who are travelling either to see a relative or a loved one who needs them, or probably more likely to go to work, who need to use public transport. So when you're wearing that mandatory facial covering on public transport, please make sure that your journey is essential. And similarly, when you're shopping, wearing a face covering. But that does not substitute for the 2-metre rule. We will only keep this virus in retreat if we do follow the rules. And that then means respecting our essential shop workers and staying 2 metres away from them and also away from our fellow shoppers. That avoiding crowded places is so incredibly important. So lifting and easing lockdown does not mean to say that people can be reckless and see more than the designated number of people they are supposed to see, even in outdoors. We have to be careful and we have to be purposeful in what we do. So we shouldn't be having large gatherings in parks or seeing more than the designated number of people we should be in gardens and other families. People are enjoying. They have been desperate to see loved ones in care homes. That real sacrifice that has been made could be lost if people are not purposeful and not thoughtful about what they're doing. Similarly, in terms of cleaning, always when you come in from outside, make sure that your door handles, your hands are washed and or gelled, and any surfaces that you do touch, try and avoid them, but if they do, then make sure that you wipe them down. The 2-metre distances I've talked about in terms of avoiding crowded places is so fundamental and so essential, and that's the advice that we have at the moment. We should not believe, because at times that is not always possible, perhaps in public transport, when you're passing people, that it's acceptable to do that. Because when you're reporting, when people are self-isolating and reporting to our Test and Protect system that they feel unwell or they've had symptoms and then they test positive, they will be asked for who their contacts would be. And the surest way of not being named as a contact is to keep following the rules so that you can live your life in a bit more freer form over the next few weeks. But I think more importantly, to remember those who have gone above and beyond a call of duty in terms of our health and social care staff, our other essential workers, but also those people who have been shielding or who have been in care homes and have not managed to see loved ones. There are many people in society who have found this incredibly difficult. Please follow the rules, make sure that we do look after each other and honour those who have had greater sacrifices than your own, and continue to be purposeful and thoughtful about your everyday actions. Thank you.
Many thanks, Fiona. I'll go now straight to questions. First today is Hazel Martin from BBC Scotland.
Thank you, First Minister. Hello, everyone. First Minister, on the subject of care homes, we have heard from a woman today whose sister has bipolar, is shielding due to another condition, and has barely left her care home room for 14 weeks. Now, she is in no way critical of the care home staff, but is very worried about her sister's mental health. They want to know what efforts will be made to assess and provide support and treatment to those who have been isolated in care homes, and what support will be available for their families who are often even more traumatised by the separation.
I'm going to hand over to the Health Secretary, who will answer that point in detail. Just a quick general comment from me. I absolutely understand how difficult this is for relatives of people in care homes, and indeed people in care homes, that isolation, being separated from loved ones and not having the interaction that all of us in care homes and otherwise find so vital to our quality of life. I just want to remind people that none of this has been done lightly or for no reason, and therefore we have to be very careful as we start to lift these restrictions in future. It's not so long ago, and legitimately these briefings were dominated by questions about whether we had done enough and were doing enough to protect people in care homes. So as we come out of this crisis and hopefully stay out of this crisis, we also have to take care, just as we had to take care going into it. And that will be the principle that drives these decisions we take. But I'll hand over to the Health Secretary, who'll give a bit more detail of the work we're doing around some of these issues.
Thanks very much, First Minister. And like the First Minister, I completely understand the challenges and the distress at times that people have felt because of these measures, which were absolutely necessary. Now, that clinical and professional advisory group that I mentioned earlier, that has worked so hard to devise this phased introduction of visiting into our care homes with the conditions that I described, is also currently working on support and guidance for residents in care homes in terms of rehabilitation, both in their mental and physical well-being, and with a particular focus on those residents who suffer from dementia. So all of that work is underway. The group itself involves care home providers as well as Scottish Care. It involves some of our prominent third sector organisations in this area, Alzheimer's Scotland, as well as significant clinical advice from a range of different but relevant professions. As that advice is worked through and the guidance is produced and the support is made available to care homes for it, then it will be communicated to care homes and talked through with them about what more they can do with their residents as we slowly and gradually ease some of these restrictions to address specifically their physical and their mental rehabilitation.
Okay, thank you. Ross Governance from STV.
Afternoon, First Minister. In a letter to its members, the EIS has said it's absolutely certain that physical distancing between pupils and teachers remains essential. It also says, why would it be mandatory to wear a face covering on public transport and, as you say, potentially shops, but not in a classroom? Does the union have a point?
Everybody who stresses the requirement to prioritise safety here has a point, and a very important point. And I think anybody who has listened to me over the past 3 months on a daily basis will know that safety issues are not matters that I think we should compromise or take undue risks on. In schools, and we've obviously had a lot of important discussion around the position in schools over the last week or so, and safety has been at the heart of this discussion all along. Back in May, when we first set out the intention to reopen schools on the 11th of August, at that point it looked to be, given where the infection was at that stage, looked to be an impossibility that we would have young people returning to school full time in August. And therefore we developed with councils a contingency of blended learning. Infection rates are now much lower. We shouldn't be and can't be complacent about that, but we are in a different place with a brighter prospect ahead, and therefore we judge it is right now to plan for a full-time return of schools in August. But there's a lot of work has to go into turning that ambition, which is clearly our ambition for reasons everybody will understand, into reality. And that work will be undertaken through the Education Recovery Group chaired by the Deputy First Minister over the weeks to come. And that will look at, are we continuing to suppress the virus sufficiently, and what package of safety measures have to be applied in schools to make sure that if children are back in any capacity, but if they are back full time, that is safe. And that will include ongoing considerations of physical distancing. It will include ongoing considerations of what testing might be required in schools, what hygiene measures would be required in schools, and whether there are other protective measures. So that is really important work, and we want to bring children back full time, but it is fundamentally important that that is judged to be safe, and that consideration will be undertaken on an ongoing basis over the summer. And if the virus starts to rise again, which I fervently hope it doesn't, and we judge that that is not possible either in August or at a later stage through the winter, we have the contingency of blended learning that teachers, and they have my huge thanks for this, and councils have been putting in place. So safety is at the heart of every step we will take on schools. But I think from the government's point of view, and I'm sure this is an ambition shared by parents, by teachers, by young people themselves, we want to get young people back to full-time education in August if we possibly can. And that is what we are planning for and will be working for in the weeks ahead. Peter McMahon from ITV Border.
Thank you, First Minister. Could I follow up on that question from my colleague there? Larry Flanagan, who's the General Secretary of the EIS, said that this decision was your U-turn on schools and returns to schools was, and he said, quotes, a political announcement. It wasn't agreed by the COVID Education Recovery Committee on which they and others sit. So why was it that you didn't consult that group? And just going back to the point that my colleague raised, if the EIS say they have serious concerns about physical distancing, John Swinney said there will be no physical distancing. How can those two be reconciled?
It's only, I think, a week ago that questions from journalists like you were demanding to know why we weren't doing more to bring children back full-time to schools. That's the luxury of a journalist, I know, and it's perfectly legitimate to ask the questions from whatever perspective. I'm going to answer the question. I'm going to answer the question fully. First of all, there hasn't been a U-turn. We have planned for a contingency because we have, until very recently, thought that full-time education in August would not be possible because it wouldn't be safe with the levels of infection. We now think that is a different prospect. So our planning assumption now is full-time, but we still have the contingency. And we have recognised that we have to work over the summer to make sure that there are the right safety measures in place to make that possible. And full-time education in schools as normal, of course, make certain assumptions about physical distancing, but if the science tells us that any particular arrangement is not safe, then particularly when we're dealing with children, we wouldn't do that. This has to be safe and it has to be predicated on continued suppression of the virus. But all governments have to plan for the scenario that they think they will be in. And up until recently, we thought that would be a scenario with infection levels too high to have full-time education. Now we think we're in a different place, so we are planning for full-time education. But the point I've made previously, when you say something is an ambition, or when, whether it's media or opposition call for something to be an ambition, that is one thing. turning that into reality is where the hard work of government with teachers and with local authorities come in. That is the hard work that we will be doing over the summer. But our ambition, and I think it is one that will be shared by a majority of parents, is to have children back in full-time education, because that's in their interest. And actually, I think it's in their interest, if this is safe, not to have them in full-time education where they're having to stay 2 metres apart from each other. But that's the detailed work that we have to do, and that work will be done through the Education Recovery Group. Natasha Reid from Bauer.
Hi there. This morning on Radio Clyde, John Swinney was on talking about the return to school and said that it might be as late as July 30th before a definite decision is made on whether schools go back full time. That's causing some concern, especially for working parents, and I was just wondering what your response is to them.
I think, John Swinney, that comment has just really illustrated what I've been saying. None of us have a crystal ball when it comes to this virus, so I can't look ahead right now and say with certainty. I know what I hope will be the case, and I know what all our modelling suggests if we keep on this trajectory is likely to be the case, but I can't say for certainty what the level of virus transmission will be come the 11th of August. So we must continue to plan our way carefully and to take all of the steps that, assuming the virus transmission stays as low as we need it to be, that we would have to put in place to ensure a full-time return. But I think, and that is what we are planning for, and that is my commitment and assurance to parents that, all things being as we want them to be, full-time return to education is what we're planning for. But I'm not a parent, but I suspect that if I was to stand here right now and say to parents, come what may, regardless of what the situation is, come the end of July, beginning of August, we're sending your children back to school full time, I suspect most parents would say, hold on a minute, how can you possibly say that? Because that has to be a decision that is based on considerations of safety. And I'm afraid when we're dealing with a virus, that does mean that we have to be prepared to assess things on a much more, a basis that is much closer to the time. So none of this brings any certainty. I've said before, and I don't mean to sound glib because I'm not glib about any aspect of this, but all of this for all of us would be a lot easier if we had a crystal ball and a magic wand. Unfortunately, I don't have either of these. This is a virus. It's a virus that I can't, sit down and give a stern talking to and tell to stop behaving in a certain way. We can try to control it. We're succeeding in controlling it right now, but we have no certainty about what's going to happen. So that means we have to plan very carefully, and we have to have flexibility in those plans, because the most important thing is the safety, the health and the well-being of children, and of course teachers and others who are in schools as well. Neil Pooran from PA.
Thanks, First Minister. The Finance Secretary, Kate Forbes, has written to the Treasury asking for additional borrowing powers to help deal with COVID. If these don't materialise, what do you think the impact would be, and can there be any other plan put in place that would protect jobs and public services and so on?
The Scottish Government will do everything we possibly can in all circumstances to protect public services and protect the economy and protect jobs, and to use our budget in the best way possible to do that. But we are facing, and Scotland is not alone here, we are facing some very difficult circumstances because of the financial impact of COVID. And Kate Forbes has put forward a very reasonable and I think very well considered argument to the UK Government about additional flexibility and additional powers to borrow. And the Scottish Government is not alone in thinking that is sensible in the current climate. Other devolved administrations have expressed similar views, and we've heard others in the land of think tanks and organisations make similar points. So we'll continue to make that point and do it because we don't want to have to be forced into decisions we wouldn't want to take for the want of sensible financial and fiscal flexibility. So I very much hope we'll get a constructive response from the UK Government, and I hope right across the Holyrood Parliament we'll see parties from all parts of the political spectrum supporting that. Conor Matchett from the Scotsman.
Thank you, First Minister. Concerns were raised by a local campaign group in Edinburgh earlier this week about the potential of Airbnbs and other short-term lets in shared stairwells becoming a vector for transmission of COVID-19. Given your announcement yesterday, will this type of holiday accommodation be allowed to open, and with what sort of safety measures? And do you agree with Fergus Ewing, who said these concerns from residents were manifestly ill-founded?
I didn't see that comment from Fergus Ewing, so I'm not going to comment directly on a comment I haven't seen. But I don't think any concerns that are being expressed about the virus that people have are ill-founded. I mean, some of them we can maybe reassure people on, but concerns that people have about this virus, given what we've all experienced in the last 3 months, should always be taken seriously. I made this point in Parliament yesterday. From the 3rd of July, we expect all holiday accommodation to reopen from the 15th of July. From the 3rd of July, that applies to self-catering accommodation that doesn't have shared facilities. Andy Whiteman asked me the question that you've asked today, and I have undertaken to make sure we give a bit more guidance to know exactly what does and doesn't fall within that. So we'll seek to do that very soon. But in principle, at this stage, from the 3rd of July, it is self-catering, self-contained accommodation that doesn't have shared facilities that would be permitted to open. Chris Musson from The Sun.
Hi, First Minister. Just going back to what my colleagues are saying on schools, the EIS has suggested that if there's no social distancing, masks could be needed, and John Swinney suggested on the radio phone in today that that could be a possibility for older kids. But the EIS have also suggested protective perspex shields could be needed for teachers. Could you envisage a situation where teachers are behind, perspex shields?
Well, don't take my answer, please don't take my answer as there are going to be perspex shields in schools. But all of these ideas and suggestions that are legitimately being made about how we make sure our schools are safe will be properly and thoroughly considered. We want schools back full-time, we want children back in school full-time in August. But everybody recognises that has to be done in a way that is safe. That is partly about ensuring the virus is at low enough levels, but it's partly about ensuring that we have the right mitigations in place to reduce the risk of the virus spreading within school settings. So all of these things, this is the work that will be done over the next period to look at all of these potential mitigation measures and decide which ones would be effective, which ones would be practical in a school versus the ones that just wouldn't be practical in a school setting, and come to an agreement with teachers, with parents and with young people through the Education Recovery Group about what exactly needs to be done. So I don't want to preempt that right now by saying one particular measure may be considered over another, but all of these things have to be properly considered and will be properly considered. Mark McLaughlin from The Times.
Afternoon, First Minister. I'd like to stick with education. So you've set this ambition, but it sounds like you haven't got all your ducks in a row yet about how you're going to achieve this ambition in terms of how you're going to protect teachers, the pupils' health. I mean, if you'll forgive the slightly pejorative term, I think it's quite apt. It sounds a little bit half-baked at the moment. Is that fair?
No, it is probably as close to being a completely unfair thing that anybody could say. We're dealing with an unpredictable virus. So you can characterise it as we don't have our ducks in a row and it's half-baked. Actually, what it means is we don't know exactly what we will be dealing with in terms of the levels of infections and the transmission of a virus, because we can do certain things to control the virus, but we know that we don't have 100% certainty or 100% guarantees that we will be able to keep it at a low level. We can all play our part in trying to do that. So we have to be flexible and we have to consider all options, and we have to keep considering the things that you have to do to protect people when the virus is pretty much eliminated and you're just trying to control it from coming in and putting out flare-ups that are very localised. The difference between what you have to do in that situation versus what you would have to do when you've still got some significant level of community transmission, these are very different things sometimes. So we have to keep all of these things under review, and we will have to continue. If I was to come right now to a fixed and settled plan for what we were doing, how many weeks away is August the 11th, 6 or 7 weeks away, if I was to say to you, here is the fully baked plan right now, and that will not change, then I would be not fulfilling my responsibilities, because we're not dealing with a situation that is fixed and unchangeable. So I'm afraid all of these plans, whether it's in schools, whether it is in hospitals or care homes, or any other aspect of life, what I announced yesterday in terms of our hopes to open up, if this virus starts to behave in a way that we don't want it to, and if we all take our eye off the ball and it starts to get out of control again, then frankly, all of that will have to be reconsidered, because we are dealing here with a virus, and unfortunately it behaves in ways that are unpredictable and undesirable. So that flexibility we need in all of our planning, I'm afraid, is just a fact of life right now. And it would be much easier for all of us if it wasn't, but I would not be doing my job if I tried to pretend to people that we could come up with a fixed plan right now that we knew with certainty was going to be the plan we needed 7 weeks from now. Think about what we've gone through in the last 3 months. Think about the changes and the experiences we've all had. And then I think we get a clear sense of the need to remain flexible and adapt to whatever this virus is throwing at us. And that's what we will continue to try to do. Tom Martin, The Express.
Hi, good afternoon. Thank you, First Minister. If I could just pick up on schools again, could you perhaps explain why the ERG wasn't possible to look at some of these other alternative safety packages sooner and put the same kind of effort in as went into the blended learning plan? Was it a case of a lack of ambition, imagination, or just simply not having correct advice?
No, it's about the changing situation with the virus. So back in May, we were looking at a situation where, assessing the virus then, our judgment was, and I don't remember anybody back then questioning this with any real sort of seriousness. Our judgment then was that the virus wouldn't, by August, be at a level where it was thinkable to bring all children back to school at the same time. So we focused on preparing a contingency. And I think if we hadn't done that, and if we hadn't made that the focus, and then the virus had not been tackled as effectively as it has been so far, I would be legitimately getting questions about why we hadn't done that. So we focused on what we thought would be the likely scenario. As weeks have passed, and as our progress in tackling this virus has been beyond what we dared to hope it might be, we've changed the planning, the principal planning assumption to reflect that. Now, if I'm standing here 3 weeks from now, and I should say, I hope, and that will not be the case, and I have no reason to expect it will be, but this is a virus that is unpredictable. If I'm standing here 3 weeks from now reporting numbers that are going in the wrong direction because we've all started to go back to normal, then I may well be saying that we're in a different place again. And it comes back to the fundamental point here. If ever, over the past 3 months, or while we're still dealing with this virus, if you ever hear me say, here's a fixed plan that we will not change, regardless of what happens with the virus, then no, I've stopped doing my job properly, because nobody should, in the face of what we're dealing with, be in that position. You have to plan for the most likely scenario that you're facing at any given time, and then if it changes, you have to be adaptable so that you plan for what then is the most likely scenario. And where necessary, you have to go back again, because I keep repeating this is a virus we're dealing with. It doesn't respect our planning processes. It doesn't respect, our human desire for certainty. It's a virus, and we have to, if we're going to beat it and keep beating it, we have to be as adaptable and as flexible as I'm pretty sure it will continue to be. Tom Peterkin from the P&J.
Good afternoon, First Ministers. The staycations are allowed from the end of next week, but the 2-metre social distancing is still required on island ferries. What do you say to people who are perhaps wanting to holiday on the islands shortly? And can you offer reassurance that ferries will be able to increase their capacity reasonably soon?
I'll offer reassurance that we will continue to take decisions that prioritise people's safety. And until such times as we change it, the 2 metres is the rule, not because we're being stubborn or I've got some weird fixation with a 2-metre physical distancing, because trust me, I don't, but because I really want to keep people as safe as it is possible to do from a virus that we know can take lives, and also, as we are increasingly learning, can do long-term health damage to people. So that's my only interest at the moment. But to do that in a way that also allows our economy to get back to as much normality as possible. So the arguments on the 2 metre physical distancing have been heard loudly and clearly. I want us to get to a position that is more viable and practical for ferries and for pubs and restaurants. I want that as badly as anybody does. But it is not, to move away from 2 metres, and this is the other side of this coin that I need people to try to understand, even if they don't agree with it. Moving away from 2 metres is not consequence-free. It's not risk-free. Nobody will tell you that moving from 2 metres to 1 metre doesn't carry additional risk, because it does. And the scientists will say that moving from 2 metres to 1 metre increases the transmission risks from anything between 2 times to 10 times. So what I've got to do, given my responsibility to try to keep people as safe as possible from this virus, is make sure we understand those risks and make sure that if we're going to take those risks for economic reasons, which is not an illegitimate thing to do, we are also taking other steps to mitigate the risks, so that we are overall, if we move away from 2 metres, we're putting in place other protections to mean that individuals are not facing a greater risk overall. And I want to make sure we do that properly, and that we don't become reckless with people's health and safety. And that's important for people who use ferries, it's important for people who will use pubs and go shopping. But actually it's more important, because as consumers we all have choices. It's even more important for the people who work in these places, who have to go to their work. I want to make sure that, as I know businesses do, because businesses take the health of their workers seriously as well, but we need to make sure we're not putting them at undue risk. So none of these things are risk-free, and none of them ever will be risk-free. But this is all a process of making sure we are responsibly managing and mitigating that risk to keep people as safe overall as possible. Now, on 2 metres, I've asked a scientific advisory group to give us, the Scottish Government, advice on this. They will do that within a matter of days next week, and I will report on that. And at the point I do, then I'll be able to say we've considered all of this. So whatever steps we take will be ones that we have made a proper consideration of. And I think that is a better way to proceed than simply doing things that you haven't properly thought through, but that could have negative consequences for people's health, and indeed in extreme cases for people's lives. Vivian Aitken from The Record.
Good afternoon, First Minister. We heard you say today that more than 4,000 people have recovered from hospital and got back home. But the fact is, a lot of those people won't have recovered fully. There are ongoing problems, as we know, with COVID. People suffering on long-term fatigue or balance issues, or even anxiety. And occupational therapists have had to get involved in a pretty much hands-on way with a large majority of them. The Royal College of Occupational Therapists also expect there to be an even bigger demand on their time when we come out of lockdown fully, with people who have shielded and are being isolated for a long time. So can I ask today, will there be any extra money for occupational therapy, and will you try to increase the number of occupational therapists in Scotland to cope with this crisis?
Well, of course we'll consider that. I'm not able to give a set commitment to that specific ask today, but generally speaking, we have to consider in the round some of what we are starting to learn could be longer term health consequences of COVID. And I'll hand over to the Health Secretary, Chief Nursing Officer, might want to say a word as well on this. But in a sense, this really, I've been talking a lot through the course of today's update in response to questions about why we need to manage on an ongoing basis through our own behaviour and through the decisions government takes. We have to manage and mitigate the risks of this virus. And throughout much of the last 3 months, we've talked a lot about the reason for that being that the virus can take the lives of people, particularly those with other vulnerabilities. And that remains a really important consideration, obviously. But as we learn more about this virus, and it's still only been in existence for 6 months or so we don't know everything about it, but as we learn more, we know that it's not just its ability to take lives that we have to be very cautious about. It's the increasing signs that for people who survive and don't die from it and who recover from it, they may suffer long-term health consequences. And that is another reason for us to be really cautious about this virus. It's not the flu. And the flu is not completely harmless, but it's not the flu. It's a new virus that is doing damage to people in ways that we don't yet understand fully. And again, that just underlines the reason why people like me in a decision-making role can't just play fast and loose with these things. We've got to consider them really carefully. But I'll hand over to Jeane and then to Fiona, who may want to say a word or two more.
Thanks very much, First Minister. The couple of things I want to say about that is that I know that you'll remember we published a framework for decision making about restarting those parts of the health service that we had paused to deal with the virus, whilst we still retain a capacity in our health service to deal with cases and to plan should that number of cases increase. So it's a difficult balancing act for us to work through, and to help do that, we have established a recovery group, a remobilisation group, which has a number of key individuals as part of that. We will meet for the first time on Monday, looking at a range of issues that we have to address in restarting areas of our health service. But critically, in amongst that is what we will do in terms of what we anticipate to be increased demand in areas of both physical and psychological rehabilitation that is coming from the emerging evidence about the impact of this virus on both people's physical health, but also where it has caused significant mental health and mental distress, particularly for those who have experienced periods in intensive care, and now thankfully are still alive and have been discharged, but they have ongoing impacts to deal with. So we are well alert to all of this, and we're working through with those clinicians and others exactly what might be the nature of that demand. And I expect that to be an iterative process as we learn more and more about the virus and what do we need to do in both primary and secondary care to ensure that we can offer people those rehabilitation services and other services that they might need as a consequence of suffering from COVID-19.
And as both the First Minister and the Cabinet Secretary have said, the post-COVID issues that people have, which we didn't anticipate at the beginning of this when we did think it was going to be like flu, for some people are quite heavy in terms of the difficulties that it's giving them. And that's why the Cabinet Secretary has asked for a rehabilitation framework to be developed. Our Chief Allied Health Professions Officer is leading that work, recognising and knowing that there's a broad range of services, that some will be already there, whether it's within mental health or within allied health in terms of rehabilitation, but some will be particular for those who've had COVID, for those who've suffered lockdown, in terms of the deconditioning that many of us will have had with lack of exercise, lack of moving about, which is why one of the very early release of lockdown was to be able to go out and exercise more than once a day. And similarly, other mental health. So going back to school for children gives them, although our school nursing services have been working over the period of lockdown, it does give children and young people access to other services and will benefit in a wider way as well as their education. So I think that rehabilitation framework is going to be very important. It will support boards to look at new and innovative ways, but it will also provide the best evidence in terms of what's happening post-COVID for people to help them recover in a way that perhaps we haven't had to face before, as well as the whole issue of deconditioning, whether it's increase in obesity, type 2 diabetes or muscle wasting, that the whole population will benefit from that wider rehabilitation. So a strand of measures that we'll be putting in place.
Thanks. Michael Blackley from the Daily Mail.
Hello, good afternoon. You've said today that you think it would be wrong to have a fixed plan on schools, but was it not the case that parents were given the impression that blended learning was a fixed plan? Indeed, they had letters from council spelling out exactly what it meant in terms of term dates for them and how many days of schooling that they would have. Was that a mistake, especially given that the Scottish Government's scientific evidence on physical distancing in schools is far from definitive? And do you still have full confidence in the decision making of the Education Secretary?
100% confidence. And how can I put this maybe a bit more simply? If this was normal times and we decided to change the curriculum, introduce a new curriculum in August, and then we'd done all the planning for that and started planning in May, got to June, and then just decided we were going to go back on that and do something completely different, then all the criticisms of why are you doing that? That's a U-turn, you know, that's half-baked, that's not thought through properly, would be entirely justified. But this is not a normal time. We're dealing with the risk of repeating myself, a virus that is unpredictable. So when I say you can't have a fixed plan, you can't have a fixed plan that you can be 100% sure won't change if the way the virus is behaving changes. But of course, you try to get your plans in place for the most likely scenario that you think you're dealing with. You try to get them as well developed as possible. So when we thought full-time education just wasn't going to be possible because of the levels of transmission, of course, lots of efforts were put into the contingency plan of blended learning. None of that is wasted because I cannot tell anybody with certainty that at some point over the next year, if we have a second wave of this virus, that won't be needed. So I actually think it's really important that that plan is in place, should it be needed nationally or in particular parts of the country if there is a localised surge in infection. But now we think we're much more optimistic about where we will be in the fight against the virus in August. So we're planning to bring children back full time. But if we see a surge again, we may have to go back to blended learning. I really wish I could stand here and say, I can tell you with 100% certainty what the situation with this virus is going to be on August the 11th or mid-September or by Christmas. I can't do that. I can tell you what we all have to do to give us the best chance of keeping it suppressed. I can tell you all the things the government will do through test and protect and surveillance to make sure that we are able to deal with it on a targeted basis, but I can't give you guarantees because, as I say, it's a virus we're dealing with, and therefore we have to keep a flexibility and an adaptability in our planning, because if we didn't do that, we would be failing in our duty to make sure that whatever happens with the virus, we've got the ability to put the best possible plans in place. So I know this is frustrating, and particularly for parents, this is really frustrating. There's no part of life over the past 3 months that hasn't been frustrating for most people, but that's just the nature of the threat we're dealing with, and we all have to keep doing the right things to try to minimise that threat, and government has to continue to plan as flexibly as we can, because we don't have the 100% guarantees that all of us would dearly love to have. Simon Johnson from The Telegraph.
Minister, in your statement to Parliament yesterday, you said that if we're really successful in clamping down on the virus, then, quotes, the move from phase 3 to phase 4 will become possible perhaps as we go into August. The route map says phase 4 is possible if the virus is no longer considered a significant threat to public health. I was really pleasantly surprised by that statement, because I'd heard Chris Whitty on the previous evening's Downing Street presser say that he would be surprised and delighted if we weren't in this current situation through the winter and into next spring. I expect there to be a significant amount of coronavirus circulating at least into that time, and I think it's going to be quite optimistic for science to come fully to the rescue over that kind of time frame. But for the short to medium term, until this time next year, certainly I think we should be planning for this, for what I consider to be the long haul into 2021. Is Professor Whitty wrong?
No, I agree with him 100%. And I actually just think you're taking two different statements and try to pretend they mean something else. So what it means in the route map when it says that it's no longer a threat to public health doesn't...
I don't pretend anything. I'm just reading what your words yesterday...
I know that, but can I finish the answer? Yeah. Because you're taking something I said. I know you're not putting words into my mouth, but you're taking the words that came out of my mouth and the words that came out of Chris Whitty's mouth, and you're trying to say, and you're perfectly entitled to test this, that they mean something different. So in terms of what I said, and in terms of what the route map says, what we're talking about there is if, when we're talking about it's no longer a risk to public health, that doesn't mean that it's magically gone away. The virus will not magically go away. What it means is that we are satisfied we've got it to the point of, and as close as possible to the point of elimination, and that we are confident in our abilities through testing, surveillance, contact tracing, and where necessary, targeted suppression measures to keep it at that point. But it doesn't mean the virus has gone away. And as I heard and read Chris Whitty, that's effectively the point we're making, that he's making. The virus is not going to disappear. It's going to be with us probably all of this year, into next year, perhaps until we've got a vaccine, if we get an effective vaccine. So we will always have to be doing things to keep it at the level of suppression. But we can hopefully go into a phase 4 when we've got it. But nobody should think when we are in phase 4, if Scotland gets into phase 4, that Scotland has somehow miraculously made COVID-19 go away. That's not how it works. So, you know, these two things that you've just read out, while, okay, on the face of it, you can make it sound as if they're saying something different, are actually all saying the same thing. So I agree with Chris Whitty. I actually thought, particularly in the context of a lifting of restrictions in England, as we have, albeit in a slower timescale, indicated lifting here, it was a very timely and very appropriate reality check to give people. The virus hasn't gone away, and it's not going to go away of its own accord. It's very, very unlikely to do that. If we're to keep it at bay, we will have to keep doing the things necessary to keep it at bay. So thank you for giving me that opportunity to set that out. Tom Gordon from the Herald.
Hello, First Minister. One of the things you announced 5 weeks ago to help keep the virus at bay was the universal testing of care home staff for COVID. Now, more than 5 weeks on, you're still only testing about a third of the staff in care homes. The latest figures show about 15,000 out of 50,000 staff. Now, whenever you're asked about this, you invariably say that the testing process is ongoing, as if that were some sort of explanation rather than a statement of the obvious. Can you explain why it is an ongoing failure rather than an ongoing success?
Well, it is a statement of fact, and I'm not sure I should be criticised for giving statements of fact when I'm answering questions. It is ongoing because it does take time, and sometimes these things take longer than I want and the Health Secretary wants, and that may be true in this case, to make sure that we have the systems that are robustly and reliably in place. But it is an ongoing process that is accelerating, and we need to then make sure it can continue in a sustainable way, and the Health Secretary will want to say a bit more about the work we are doing to ensure that. So there is no attempt to deflect or to avoid these things. I want it to speed up. I want it to get to the point where we have a steady state performance where we are reliably testing every care home worker on a weekly basis. And of course, we'll want to see that in other sections of the population as we proceed as well. The one thing I would say, though, which is not actually intended to, in any way take away from what I've just said, because it is really important, is that we are also seeing through the package of measures, because we've always been clear, testing is only one of a number of things we have to do in care homes to protect from the virus. We are seeing case numbers of homes with cases and thankfully the numbers of people dying in care homes rapidly reducing. Now, what that would say is while we're on every aspect of this and testing in particular, not yet exactly where we want to be for the future, the things we are doing in care homes and the things care home providers are doing are having the effect of driving down infection, which is another reason why I wouldn't quite describe it in the way that you have. But I'll hand over to the Health Secretary who wants to say a bit more about the progress on testing.
Thanks very much, First Minister. And just to follow on from what the First Minister has said, it is important to remember that testing all care home workers, so that includes care home workers in homes which have no case of COVID-19, is one of the precautionary measures in order to prevent the introduction of the virus into that care home. But it is one of the precautionary measures. That doesn't mean it's not very important. It is very important, nor does it mean that I am currently satisfied with the pace that we are seeing in testing those care home workers, as First Minister says, every 7 days. However, between the previous week and the week that's just been reported, the number of tests has doubled. So that is a degree of progress that should be recognised, not enough yet, but we also now have secured significant number of additional testing kits from the care portal, and that will allow us to continue to increase that number week on week. We then need to keep it steady, and we need to keep it running for as long as we and our advisors consider that to be necessary. So that's the work that's underway. Some progress, not fast enough yet, but it is something that I look at constantly and try and identify what more can we do to increase the pace to get where we need to, as well as making sure that all those other important infection prevention and control measures are being followed in our care homes.
Thanks. And last question today, Tom Magner from Carers World Radio.
Thank you very much indeed, First Minister. Carers World viewers will cautiously welcome your announcement on limited residential care home visiting. But given your answers to the previous question on staff testing limitations, how do you address the ongoing entrenched unpaid carers' fears about COVID-19 in care homes? How in detail will you watch out for and react to any new outbreaks specific to a particular care home, should that happen with the new limited visiting?
Okay, I'll hand over to the Health Secretary, but I would, and I don't want this to be taken or received actually as a sign of complacency, because we must never be complacent in care homes or in the community against the virus. But we are seeing significant reductions now in the numbers of care homes with an active outbreak, the number of new cases every day, and thankfully the number of deaths. And that should give all of us some reassurance about the steps that are being taken. But you're absolutely right, as a bit like society generally, as we start to open up again, the risks of transmission increase. So we need to make sure that through surveillance and testing, we are absolutely alert to any resurgence that we can deal with very quickly.
Thanks very much. So I want to just recall that the care homes that will be permitted to have that one designated visitor per resident who has to wear a face covering, and the visit will be outside, there will be other hygiene and precautionary measures in place. But those care homes will only be the care homes that have never had a COVID-19 case, and there are a significant number of those, and those other care homes who have been free of any COVID-19 case for 28 days. And the local NHS Director of Public Health will have to agree for those care homes that that is possible for them to have that visiting. In addition, we will know which care homes we're talking about. So as well as that increase in the pace of testing of care home workers, we will be placing a careful look to see that there are no residents displaying any symptoms. Remember too that round our care homes we have wrapped a significant level of clinical and primary care support and supervision, led by our Directors of Public Health, but importantly with our NHS nurse directors heavily involved, in order to ensure that all the care homes have the right level of staffing, they have the right level of PPE. We've been doing that since the 19th of March. People are confident in using that PPE, and that they know what good infection prevention and control looks like. All of that taken together have seen improvements to date. More improvements are needed, but we will be very vigilant. And that is why I said in opening up visiting to care homes, this is a phased and cautious approach, because we are very mindful of paying attention to being alert to the risk that is involved here. We know that families and friends will adhere very closely to those conditions because they care about their loved ones. And we're trying to get a balance between allowing that care with face-to-face visiting, with keeping very tightly on top of infection prevention and control.
Thank you. That concludes the questions for today. My thanks to the journalists, thanks to Fiona and Jeane and Rachel, our BSL interpreter for the day, and thank you very much to you for joining us. I'll be back here tomorrow at 12:30 for tomorrow's daily update. In the meantime, can I end simply with a reminder of the 5 basic steps that we all need to take now as we get out and about a bit more to make sure we are keeping on top of this virus and not allowing it to spread again. So please wear a face covering in enclosed spaces. Avoid crowded places, clean your hands thoroughly and clean any hard surfaces that you touch. 2 metres distancing remains the advice, and self-isolate if you have symptoms of COVID, which is a new cough, a fever or a loss of or change in your sense of taste or smell, and immediately book a test. Don't wait to see if you feel better, that we all have a tendency to do normally. If we don't feel well, if you have any of these symptoms, go to NHS 24, NHS Inform website and book a test immediately, and you and your household, apart from going out for the test, should self-isolate. And if we all follow these 5 basic measures, then hopefully, even if we start to interact a bit more and get more back to normal, we will keep this virus under control, because that matters more than anything right now, not allowing it to take a grip of us again after all the progress we've made. So my thanks very much to all of you, and I will see you tomorrow.